You're tuned into ClaVille and LaVeist at ClaVilleandLaVeist.com. And we're here with Dr. Thomas LaVeist, who's the Dean of Public Health at Tulane University, talking about COVID in Black America and also health disparities in general. Tom, you're the Skin Youre In project. It's a multimedia project, includes a book, it's a docu-film series. You actually began this several years ago to address the issue of Black health disparities and why African Americans live sicker, die younger than other groups in the nation. Talk about that project, in the context of what we're experiencing now.
I mean, it's a project that I think, as you know, I've been working on for several years now to address this issue of racial disparities in health. COVID is just the latest example, but we've had these disparities by race for as long as we've had the ability to collect data and see what the disparities are. So, we've been trying to learn about why the disparities exist and what we can do to address them. And that's what I've been doing over the last few decades. And the idea behind the Skin Youre In was to develop a project where we can communicate to the general public. So get out of that, the conversation with other research scientists and move out to the general public and communicate to people what we have learned over the last few decades about these disparities and what people, need to know to be able to take care of their health and live longer and more healthy lives.
And so it's a docu-film. It's also a book, right, that you're working on. It's a multimedia website, tsyi.org. A lot of the reasons, as I mentioned in the previous segment, you have this battle of information and misinformation going on, particularly with a lot of the anti-vax actors out there. I mean, talk about that. And particularly, you see that on the internet. It's got to be frustrating for you to see how a lot of this misinformation is targeting our people.
Well, it's frustrating, but as someone who's in this battle, I can't really let myself get frustrated. I have to keep battling. It's not new. I mean, we've had false information promoted to the Black community about all sorts of things, about the health effects of cigarettes. Menthol cigarettes are healthier. Well, in fact, it's the complete opposite, right? As they were being marketed to Black people. Fake and false information about diabetes. Diabetes runs in the family. Diabetes runs, type 2 diabetes runs in the behavior, and what you're eating and how you're taking care of yourself. So there's been a lot of, misinformation, and there's a lot of mistrust that makes it even more possible for the misinformation to seep into the community. But the mistrust comes from a real place. It comes from, untrustworthy behavior that people have been exposed to over the decades and even centuries in this country that make African Americans mistrustful.
Tom, you mentioned something that just made my mind go back a couple of decades. When you talked about the misinformation about a healthier cigarette, again, to me, that's a dichotomy within itself. Smoking, the way that we manufacture cigarettes is not healthy at all. Our lungs are not meant to have smoke in it of no form. So when we talk about you mentioned the disparities in African American health and Black communities, which we know for decades. And, if you go to if our audience goes to your website, LaVeist.com, you'll see tons of your articles, your books that you've written to push this narrative out to educate the public, which I think is phenomenal. But if we know that these disparities exist, and we know that this misinformation is out there, then why would our society push these products, these deadly products, into the Black community, who's already struggling?
Profitable.
Again,
because it's profitable.
Well, Will. I mean, look, we understand it is money, but I want to hear from
destruction is profitable.
Policy standpoint, right? Just to see how they drape, this logic and moving forward. But Tom, you understand what I'm saying? I mean, we know that malt liquor is terrible. We know that menthol cigarettes are absolutely terrible. We know that, all the worst parts of the pig that's put into our grocery stores is bad for your health, but we still push it. I mean, what is the reasoning behind this?
Well, I mean, I think clearly there is a profit motive behind it. I mean, some of the Think about pharmacy chains that sell cigarettes.
Talk
Think about that.
about talk about a contradiction.
Right.
Oxymoron. Take your pick.
Yeah,
A
actually, it's the CVS. I think stopped maybe 5 years ago. You know,
CVS now refuses to sell cigarettes, and they should be credited for that. They sold them for many years, but CVS now does not sell cigarettes because it's a pharmacy is supposed to be part of the healthcare infrastructure, but they're selling cigarettes. Now they do still sell potato chips and sugary drinks and all sorts of
Hey,
other
in
products.
moderation. It's
But think
okay.
about it. But think about it. It's about the profit motive, and profit comes when profit comes up against health. Health usually loses.
What has been the reaction so far? One of the things with the Skin You're In, that project, we had an opportunity because I've been a producer in the project. Tom is the executive producer. We've had a great opportunity to go around the country and meet with people who are not just sitting back and doing nothing about this, but actually getting out. I remember a sister down in, what was that? I was in Tennessee, Nashville, who was going around. We filmed with her going around doing CPR on the spot in the neighborhood, in bars. I mean, talk about that sister. I'm forgetting her name right now. Talk about it.
Yeah, unfortunately, I am too. So I wish you had a Catherine Brown, Dr. Catherine
Right,
Brown,
right.
at Vanderbilt University in Nashville. I met her in Chicago at a meeting that the American Heart Association had put together with a group of African American public health researchers and national pastors, nationally known pastors, and we were kind of talking about heart disease in the Black community. And we were about to, at the end of the meeting, she stood up, and this sister said, "How many of you here do not know CPR?" And most of the people in the room raised their hands. She said, "No one is leaving this room until they learn CPR." And this sister taught everybody CPR. And you had some of the famous, well-known pastors down there on their knees doing CPR on the mannequin. She was like, "You're not getting out of this door until you know CPR." And she was just so impressive. And she walks around in the hood and just like walks up to people and say, "Do you know CPR?" And demonstrate, teaches them, knocks on people's doors and teaches them. And it's important. It's really important because there was a study done by American Heart Association that showed that if a person was incapacitated and needed CPR and they were in a white neighborhood, they were over 33% more likely that there would be somebody nearby that would know what to do. And that it's just something that's very inexpensive to learn, easy to learn, it's cheap to teach it to people, and we should be teaching it in high schools.
yeah.
We're teaching it in middle schools.
Tom, you mentioned that type of grassroots teaching about health, and I remember growing up in church, and I grew up in a church where it was a Pentecostal. We've always been Pentecostal. And not only that, but we also had highly educated African Americans. We had Ph.D.s in our church and people, persons with master's degrees and so forth. And we're talking about the 70s and 80s, right? So this was highly unusual. We had nurses in our church. So I remember every fifth Sunday, we would have the nurses would actually have a room and they would come check your blood pressure, if you had questions about your medicine and things about that. And I remember Missionary Barnes, she was a nurse. In the early 80s, I want to say 82, 83, she started talking about this new disease called HIV and AIDS, HIV, AIDS. And we would have education about what AIDS was and the devastating effects of it. And, as a kid, this was normal to me, right? It was normal for me to see this. But I realized as I got older, a lot of people don't have that advantage where they can go to professionals who look like them, grew up with them, and ask them those questions. So, from your standpoint, from a policy standpoint, how important is it for us to go back to or create a grassroots movement of just educating people about their health, what is healthy, what's not, and eliminating misinformation as we talked about with vaccines?
Yeah, I think that absolutely has to happen. In fact, tomorrow I'm going to be speaking via the Zoom to a church about this very issue. I mean, we need to be out there doing that, and I think all health professionals need to do whatever they can to educate as many people as possible because, we can do a better job of taking care of our health, but most of us just don't know what to do. And if you just follow if you just go by what you see in the media, which is going to be mostly television commercials, try to get you to eat certain things and live certain lifestyles, you're going to be misinformed and a lot because there it's the profit motive that's driving that messaging, not actually your health. So I think every health professional need to use every venue possible, including churches, to reach people.
I think that's one of the things that we found with the film is that there actually are a lot of people who are out there and really actively doing things and trying to make a difference. And they don't often get the attention because of the way the media operates in terms of not having time. This is not sexy. This is not controversial. And the profit motive that is behind the media. So it's important to understand that there's a lot of people who are doing things, which means there's a lot of things that people who are listening to us right now can be active starting tomorrow, starting today in their community if they choose to. They can find something to do and get busy.
And I think you'll find that people will come forward and help if you ask them to help. If you give them an opportunity and a way to help, I think you will find that most Black health professionals will help. When I reached out to my colleagues in the National Academy of Medicine to say, listen, I want to write this, I want to do this letter, and we want to put it in the New York Times. We want to communicate to our community about COVID-19. I was able to very quickly get 60 of them to come forward and say, sure, I'm willing to sign on to that letter. And it was only 60 because I could only get to 60 people in the amount of time that I had because we didn't have a directory. I know we could have doubled that number if we had more time and reached out to everyone. Since the letter came out, I had received numerous emails from other members saying, how come you didn't ask me? I didn't ask you because I didn't know, I didn't know everybody. But, people want to come forward and people want to use their voice. And about that article, so we wrote this. I organized 60 of my colleagues from African American members of the National Academy of Medicine to support the editorial that I wrote for the New York Times. Was published last week, and the one pushback that I did get some. I mean, I got a lot of praise for it, of course. President Obama tweeted it out, and it got a lot of attention from that. But I did get some pushback saying, "Well, why would you put this in the New York Times? That's not a media that targets the Black community, and who knows who the National Academy of Medicine is? Why would that group think that the Black community will listen to them?" And I did want to respond to that a little bit, if I can use a little bit of your airtime to do that. Say that first of all, I'm an African American. I've had a subscription to the New York Times since I was a teenager. So this stereotype that Black people don't read the Times is insulting, quite frankly, to a lot of Black people that I know that do read the New York Times. But it was never our intent to reach the general public. Our goal was not so much that we were going to reach the man on the street, and the man on the street would say, well, the National Academy of Medicine members said you should do this, so I'm going to do it. Our goal was to reach influencers, was to reach those pastors, to reach the teachers, reach the policymakers, politicians, people, celebrities, athletes, entertainers, people that have access to people that have a platform, and to show and to give those people some assurance that yes, there are African American scientists that were involved in developing these vaccines, and there are African American scientists involved in doing the reviews for the for the FDA, and there are African Americans involved in distributing the vaccine. And then we know what we're talking about. We are a part of the Black community, and we believe that the vaccine is safe and effective and healthy, and that we think that you should listen to people who know what they're talking about, as opposed to listening to other people in the community who may not be as informed. And maybe some of those influencers will now be more comfortable coming forward and recommending that people get vaccinated.
But Tom, you got to admit that the man on the street too, if he hears that there are Black health professionals, scientists at the top organizations that are saying you need to get that vaccine, that's going to combat the information that man on the street is getting from the anti-vaxxers. Because the anti-vaxxers are not trying to talk to the pastors. They're trying to talk directly to people on the street. So the more that you all, as the top health professionals in our nation, that the man on the street believes doesn't even exist, the more that you all talk directly to that man on the street, especially somebody like you that comes from the hood. I know because I was there with you. And we went back and we filmed and we got a whole lot of love. You got a whole lot of love and you went right back into your hood instincts and was right at home. So you was more at home, back home, than in some of these communities that we've been in where there's not people like us. So when people from our neighborhood see you, as we experienced doing the film, they want to hear from you and they vibe with you as more with their own pastor, because a lot of the people don't trust the pastor and don't trust a lot of these people that we claim that we think are influencers. All right, somebody say amen.
Somebody say that's amen. Another show for another day. That's another show for another day, man. Listen, but I want to commend Tom on that article, and I understand exactly what you're saying. And we do need to go back to that grassroots effort, but the influencers, that's a very important part of this, because a lot of times we see it is important that we let influencers know that there are African Americans at the table, involved in the research, involved in the review, involved in writing of the articles, involved in the approval and the improvement of our healthcare. Because a lot of times what we see non-African Americans, but quote unquote people of color, representing the voice of Black people in our country, and more specifically African Americans. Very rarely you see African Americans, Black people who had our upbringing, like all three of us on this show right now. As a matter of fact, I want to give a shout out to President Hrabowski at University of Maryland, UMBC, Baltimore County, and the program that he runs there, getting kids into STEM fields, because he was recognized and his students were recognized as one of the major researchers on this particular vaccine. So you're talking about kids from our generation who came through these programs that never thought about being an epidemiologist, right? But all of a sudden they get this opportunity and say, hey, I could be an epidemiologist. I could be a person that studied viruses. I could be a person in the lab in a white coat and still be a doctor as opposed to a person treating. And there are other programs out there that do this. Howard University CAR-STEM program.
Well, Eric, that's Tom's homie. Dombrowski that's Tom's homeboy. Tom knows it real well. That's another example of somebody who is operating at the highest levels in their career, but also can go right down to the people like Tom can and be absolutely.
You guys come out of New York, I come out of Louisiana, Browski comes out of Alabama, but we all have that common thread between us. Exactly. We were raised in Black communities, Black experiences, Black parents, and we understand better than anybody else, what our surrounding is. So again, hats off to you, Tom, for pushing that envelope.
And that's a key reason why we've done this show, right, Eric? Because those of us that have all these letters after our names, but can still go right down into the community, in the neighborhood, and treat people as equals. That's one of the things that comes through in the film that I have to say that Tom, as the executive producer, did an excellent job in. When you see that film, The Skin Youre In, tsyi.org, you're going to see the brothers and sisters in our neighborhood, Brownsville, are also experts sitting side by side with the other trained experts as they talk about their experiences. And that's one of the things that when we showed the film in the neighborhood, went back home and showed that segment of the film, because it's going to be a 5-part series or more series. One of the things that the people said, that our people who grew up knowing us said, that they appreciated us showing them as being health experts along with the trained professionals. And it comes through powerfully in the film. And that's something that was Tom's vision. I mean, talk to that, Tom. How did that reaction, how you felt about that?
Yeah. Well, I think that's right. I mean, I think that they are experts. I mean, so everyone. I mean, that was very intentional. The way we lighted people up in the shots, the way we framed them on the camera, the way we set them, and and conducted the interviews. We conducted everybody exactly the same way, so that we've got Alvin Poussaint, Dr. Alvin Poussaint from Harvard Medical School there, and then we've got just a guy in the neighborhood who's talking about his experience, and he is an expert on his experience. And so we treated him like an expert also. We shot him the same way, we lighted him the same way, we used the same types of questions, and we allow him the opportunity to bring his voice into the film. And I think that's what makes the film effective, is that you're hearing the professional expertise, you're hearing the lived expertise, and you see the consistency in that message, and see that the people in the community are also very knowledgeable about the situation that they're living in and why things are as they.
Tom, as we wrap up, man, I appreciate you joining a time with Eric and I, LaVeistandClaVille.com. You can learn more about the film, The Skin You're In, at tsyi.org. Again, that's tsyi.org. You can also learn more about Dr. LaVeist. Any final thoughts regarding this whole issue, the vaccine, health disparities?
Well, I just wanted, my parting shot is just to thank you all for having me on the show and giving me an opportunity to reach the community and talk to the people about the importance of getting vaccinated. We may not know the long term effects of being vaccinated, right? We don't know if there'll be some long term side effect that won't show up for the next 5 years or something like that. But we do know that there are long term effects of being infected with COVID. Over 450,000 Americans have been killed. That's more than one out of every 1,000 American. There's probably not a single African American in this country that doesn't know at least one person that has died from this disease. Yeah. And in those that have not died, people who have survived it, we're coming to learn, have long-term struggles. They're still having health problems, and those health problems might be lifelong. So the effects of COVID, you've got to weigh the effects of COVID versus the long-term effects of the vaccination. And I think if you do that calculation, you have to come to the conclusion that you're better off not taking your risks with getting infected and getting that vaccine as soon as you have an opportunity to get it.
Well, again, Tom, I want to thank you for coming on to this show and really breaking it down. And that's what we're all about, going beyond the veil, pulling the curtain back, and really talking honestly and earnestly about these issues. So you've heard it from here. And that's it for LaVeist and ClaVille for this particular show. Catch us on our website, LaVeistandClaVille.com. Catch us on Facebook, Twitter, Instagram, all the social media. If you have a question, email us at LaVeistandClaVille@gmail.com. And until next time, be well, and we'll see you again.